What is the proper way to code two services in the same group by different providers, specialties on the same date? Example, a psychiatrist and a PCP in the same group seeing the same client on the same date of service. Hey, that is really a great question. That's a practical question and not one you're necessarily going to see on an exam. What do you think, Schuyler? Or did you have this one already?
I answered already.
Oh.
Well, what's your answer, Schuyler?
Well, the E&M guidelines specifically state that if, especially for, established patients, that if it's within a 3-year time period and it's in the same group, same specialty, it still uses that established E&M visit. Now, this is different specialty, and it is the same. It may be the same group, but different specialties. So there are different E&M levels. I mean, psychiatrists, it may be more of a psychotherapy note. So obviously, that in and of itself is a totally different E&M.
So it's not going to be a problem. Okay, so what if you have a cardiologist seeing a patient and the PCP? Same thing? Because they're two separate specialties?
But another key point there on my end, on the billing end, they have to be listed with the insurance carrier as different specialties. So, in our office, we're orthopedic, and we have, we could have somebody come in who might be podiatry specifically, but working with the orthopedic group. They have to be listed as a different specialty. So, I mean, those are too closely related. I wouldn't even attempt that one. But a psychiatrist and a PCP, as long as they're listed as different specialties with the insurance carrier, of course, they have to have different notes. They can't borrow one person's notes for their
copy
notes.
And paste.
There's none of that copy paste, nothing. So as long as they have their own distinct separate visits and they're listed as different specialties, they can bill two services.
And there's one thing to note about psychotherapy notes. There are certain, when it comes to release of information, there are certain things in different states in which they have to get approved by the patient itself. They can sign even if they've had any alcohol therapy notes or any psychotherapy notes, that can be more protected and they cannot share that information. So that's something
that's true.
This one that's very special, that those would definitely have to be kept separate in the event that that patient does not want that information being sent out. And if a provider does that, shame on them, but they're going to be going through a lot of issues.
So I'm thinking that's a really good point. I think we are still trying to catch up with mental health. And now that mental health is being covered by the payers more than ever before, that just puts us on an even higher learning curve trying to do that. So with this question, I'm thinking of these small physician groups that, well, I guess they're not really small, but when we were in Texas over in San Angelo, you had Shannon Health, and then you had another group that was, you had Memorial Hospital, was Memorial, it had another hospital, but they also had an ancillary physician group that was connected to the hospital, but they were in their own entity in and of themselves. So and there was several specialties in there, and I can see how, like you said, if you go to a cardiologist, but because you live out in the country, you don't want to keep going to the doctor, so you're going to go get your diabetic foot checked by the podiatrist the same day, right? And stuff like that. But that's two separate specialties, so they would bill separately, and then make sure that the insurance knows that they are specialties. One at the bottom of the CMS 1500 form, where you put the provider's name and their number, is that not enough? The payer has to have them listed as well?
You have to be listed separately with the payer, because even under your NPI, when you go to the NPI data bank and stuff, they list specialties, but like that, we got to remember that number stays with them forever. So
Yeah.
when they're a resident, they have that number. And then, when they go into a specialty, so those things have to be updated and changed. Somebody did ask, there's 2 more questions that have come in about the same thing. A modifier 25, Deborah asked, no. Remember what's modifier 25? Separately identifiable procedure.
Yeah, not
On the same
provider.
day as an E&M. So these are 2 E&M services. You're not going to modify one of them with a 25 modifier. Somebody said it's based on your taxonomy or tax ID code. Well, but you could have one full big group under the same tax ID, but different specialties.
Yeah, it really comes down to credentialing. Credentialing is a huge part.
Which goes to compliance, right? Because that's usually the compliance officer that has to handle all that. It's all about compliance. I don't know how to tell you.
I mean, every certification exam will have some sort of compliance questions on the exam. It's really important, and it's important to know your role in it. I mean, it's your job and your responsibility too. Not, like I said earlier, not just that.
He's a compliance guru, so he's always going to say compliance. He's like over here on my screen. Yeah. But it is just so true. When getting back to compliance, I did go take the compliance exam. I didn't pass because even though I studied a little bit, I kind of thought I would wing it because I didn't do too bad on the practice exam. But the fact is if you've been in the medical field for any extent of time, a lot of this stuff is just no-brainer stuff in compliance, right? Because it is in your life, no matter what in the medical field. It is just there. Now, that being said, that tells you how important being really, truly knowledgeable is, not thinking you know enough to go wing a test. But, take the time to study compliance. You may be called to look up compliance issues or maybe be your office's compliance officer. Every office should have a compliance notebook, and we're called to wear separate hats. So again, just taking the course, even if you don't get the credential, may be something that you can put on your resume that says, hey, I took a compliance course, and then it's like, hey, okay, we want her, because we know that if there's compliance issues, at least she'll know where to look. So it's always an issue, always in an office.
Oh, yes. Not just offices, but every specialty.
Every specialty. Mm-hmm.
Yep.
Do you need more medical certification and business training? Learn more at www.cco.us.